Today's video topic is Eisenmenger Syndrome. What is Eisenmenger Syndrome? Eisenmenger Syndrome is a medical condition in which the blood flow from the heart to the lungs is affected in those who were born with an anatomical abnormality of heart or a congenital heart defect. Eisenmenger Syndrome is a life-threatening condition. The irregular blood flow causes the narrowing and stiffness of the blood vessels in the lungs that lead to rise of blood pressure in the arteries of lungs, pulmonary arterial hypertension. This can potentially lead to permanent damage of the blood vessels in the lungs. What actually happens is that the blood pressure increases in the part of the heart that has blood with poor oxygen levels, which we also call blue blood, and this blue blood further flows in the whole heart and its vessels, which causes mixing of oxygen-rich and poor oxygen blood, ultimately leading to low oxygen levels. What are the causes of Eisenmenger syndrome? Eisenmenger syndrome is usually the consequence of an unrepaired hole or shunt between the main blood vessels or chambers of the heart. A shunt is a congenital heart abnormality, which means a heart problem present at birth, such as a ventricular septal defect, an atrioventricular canal defect, an atrial septal defect, or patent ductus arteriosus. What are the symptoms of Eisenmenger syndrome? The symptoms of Eisenmenger syndrome include blue or gray skin coloration due to low oxygen levels, cyanosis in the blood, shortness of breath while at rest or after little activity, skipped or racing heartbeats, palpitations, chest pain or tightness, coughing up blood, large rounded fingernails or toenails or clubbing, dizziness or fainting, or headaches. How is Eisenmenger syndrome diagnosed? Blood tests, a complete blood cell count done, LFT and RFT, electrocardiogram, ECG, to measure the electrical activity of the heart, chest X-ray, to take a look at the condition of the heart and lungs. Echocardiogram shows the blood flow through the heart. Computerized tomography or CT scan to look at the cross-sectional images of the heart. Magnetic resonance imaging, MRI scan of the lungs to create detailed images of the blood vessels in the lungs. Cardiac catheterization, a thin, flexible tube or catheter is inserted into a blood vessel, usually in the groin or wrist, and guided to the heart. Dye flows through the catheter to the arteries that defines the image of arteries more clearly on X-ray images and video. Walking test. A 6-minute walking test is done to see how well the patient can tolerate a mild exercise. How is Eisenmenger syndrome treated? Medications. Medications are the main treatment for Eisenmenger syndrome. Although they can't cure it completely, they can help in improving the life quality of that person. Antiarrhythmics help in controlling the rhythm of heart and prevent irregular heartbeats. Iron supplements. Aspirin or blood-thinning medications. Drugs for pulmonary arterial hypertension to increase the supply of blood to the lungs. Surgeries. Surgery may be needed if nothing among the above-mentioned treatments work and the patient's health keeps on deteriorating. Blood withdrawal, phlebotomy. Transplant of heart.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest